Hi, I'm Alexandria Lanza. I'm a licensed professional counselor in New Jersey, specializing in perinatal mood disorders. Let's talk about anxiety during pregnancy. Did you know that anxiety and related disorders is actually more common than depression for women who are pregnant and during the postpartum period? Pregnancy is a time of great uncertainty, and all of these changes, from physical, mental, and social. Our society has this awful expectation that pregnant women are supposed to be happy all the time because they're pregnant, but honestly, that's just adding more stress, which leads to the anxiety. So what is a normal amount of anxiety during pregnancy? It is absolutely normal to feel a little bit worried. You know, you're growing a new human inside of you, and you're not just thinking about yourself anymore. You're starting to think, am I eating too much, or am I not eating enough? Am I sleeping too much, or am I not sleeping enough? Can I work out? Should I work out? All of these questions are perfectly normal. But when the anxiety starts to disrupt your day-to-day activities, and maybe you find that you can't really focus on anything at work, and you're just focusing on this worry about you and your baby, it might be time to seek some treatment. The issue is that the anxiety symptoms during pregnancy also reflect the same pregnancy symptoms that a normal pregnant woman would have. Fatigue, shortness of breath, overeating, heartburn. These are all symptoms of both a normal pregnancy and a very anxious pregnancy. Symptoms of anxiety during pregnancy and the postpartum period may include, but are not limited to, racing thoughts, hypervigilance, constant worry about your health and your baby's health, physical symptoms like dizziness, nausea, heartburn, sleep disturbances, changes in diet, and just this overall constant worry that something bad is going to happen to either you or your baby. There are many different causes for anxiety while pregnant. You might be someone who struggles with body image, and the idea of gaining 40 to 60 pounds while pregnant is really taking a toll on your self-esteem. You might be someone who's worried about the nursery. What if it's not done on time? Do you have enough clothes? What if you've never changed a diaper before? Wait, do you have wipes? All of these things continue to come up in your head. And again, for the most part, they're normal. Did you know that you'd be considered to be having a geriatric pregnancy if you were over 35 and pregnant? But most people aren't even leaving their families' homes until about 34, 35. Interesting statistic. Also, women who are struggling with infertility or had previous losses, miscarriages, even abortions, they may struggle throughout this whole period. You know, some people find it difficult to reach out for help. They may not even tell people that they're pregnant out of fear that they may lose the baby again. These are all, again, normal symptoms. But if they do become a little more severe, then support groups and treatment professionals are always available. Many moms find themselves putting their baby before their own self-care. But it's really important to remember that taking care of yourself is taking care of your baby. Your baby feels all of the emotions that you feel. Your baby is being nurtured by all of the food that you eat. Your baby is going to experience relief if you are talking with someone when you really need that emotional support. There are professionals who are focused on these types of mood disorders, and they're able to help you through this. This may be surprising to hear, but there are medications that mothers can take while being pregnant that won't actually harm their baby. I would definitely suggest finding a prescriber who is up to date in perinatal mood disorders and medications. Some doctors that may be able to prescribe are psychiatrists, midwives, psychiatric nurse practitioners, or other medical professionals. It's important to know that there are resources for mothers and their babies, and early intervention is always key. You might be able to find support from lactation consultants or midwives or doulas, faith communities, mental health providers. You know, each of these different providers might have a different type of service that they can provide, but all of them are important and will support you through your pregnancy. If you find that you're suffering from anxiety during pregnancy or the postpartum period, it's important to know it is not your fault. It is not uncommon. There are resources and help available, and most importantly, you will get through this.